Paul Ryan's new budget plan looks a lot like Paul Ryan's old budget plan. Smaller deficits, a simpler tax code, and a shakeup to Medicare that would create a whole new system for getting care to seniors. The House Budget Chairman unveiled the Republicans' 2014 budget plan Tuesday, slashing the national debt by rolling back many of the president's plans and through hopes of rapid economic growth spurred by more free market ideas.
We believe that we owe the American people a balanced budget. And for the third straight year, we've delivered. And this is a document, a plan that balances the budget in 10 years.
Ryan's plan preserves the existing Medicare system until 2024. That's when seniors would be given the option to pick a different insurance plan as part of a new Medicare exchange program, with the government competing with private insurers for seniors' business. If seniors pick a more expensive plan, they pay the extra costs themselves. A cheaper plan than the one offered by the government sends money back to the seniors through a rebate check. Ryan calls the money given to seniors to choose that plan a premium support payment, but critics call it a voucher, saying its reliance on the private market doesn't adequately assure seniors will get the benefits they need the way the government can. The proposal keeps in place the $716 billion in Medicare cuts made by the president's health care reform, cuts Ryan derided on the campaign trail last year.
$716 billion funneled out of Medicare by President Obama. An obligation we have to our parents and grandparents is being sacrificed.
While the president's plan takes those cuts from payments to hospitals and insurers, Ryan would cut back on benefits offered to seniors, and he'd give the states, not the federal government, more control over how Medicare funds are spent. In an analysis of Ryan's plan, the nonpartisan Congressional Budget Office says although more freedom given to states could, quote, achieve greater efficiencies in the delivery of care, the large reduction in payments would probably require states to reduce eligibility or provide less extensive coverage. Although it's easy to get lost in the details, legislative realities will likely make Paul's plan dead on arrival. For example, his budget accounts for the repeal of Obama's health care reform. And as Fox News' Chris Wallace noted Sunday, that's a pretty tall order.
Are you saying that as part of your budget you assume the repeal of Obamacare?
Yes.
Well, that's not going to happen.
We don't think health care is going to be improved in this country. We think it's going to look very ugly over the next couple of years.
Democrats in the Senate will propose their own budget for 2014 Wednesday. It's safe to say Obama's health care reform will be staying put in that plan. For Newsy, I'm Zach Toombs. Multiple sources, a broader view.